This week, Oregon's new risk system went into effect, using those 4 different levels we've been talking about to set different restrictions on daily activity in each county. And right now, most counties are in the extreme level.
Yeah, each day we've been checking in with different counties in the metro area on how they're adapting to the changes. And joining us live this morning, Washington County Health Officer Dr. Christina Baumann. And thank you so much for joining us, Doctor.
Thank you for having me.
How is Washington County doing right now when it comes to COVID-19?
Yeah, we've seen a really huge increase in cases over the past couple months. To date, we have 11,000 cases of COVID-19. We've had over 100 deaths, and about half of our cases is affecting our Hispanic and Latinx population. So between a couple months ago to today, we used to be seeing about 50, 60 cases a day. Now we're seeing between 200 to 300 cases a day. So with public health, we're still doing all right, getting in touch with those cases to get them counseling, education, and to address outbreaks, but we're not able to reach out to all of their contacts. And so we're really asking people to do that work, to talk to their contacts if they do test positive for COVID-19.
Yeah, it is really a dire situation. I mean, we are seeing this nationwide surge going into the Thanksgiving holiday. And then just this week, you have Dr. Anthony Fauci talking about seeing this surge now coupled with a Thanksgiving surge, post-holiday. Any predictions on where this trend is heading? I mean, how much worse could this get before we start to get better?
Sure. Well, Washington County, as you know, is in the extreme risk category. The threshold for that is 200 cases over 200 cases per 100,000 over 2 weeks. And right now we are double that. And so we will be in the extreme risk category probably for a while, definitely through December. As you said, we don't yet know what the effect of the changes that people made to their holiday plans will have, or what the effect of the policy changes with the freeze and these new risk categories will have. We know that these types of changes have helped in the past, and we're really hoping that the efforts that people made will help bend the curve.
Have you identified how the virus is spreading?
So we know that the virus spreads when people gather. We've talked a lot about the effect of small gatherings, especially over the holidays. What hasn't really gotten a lot of attention is spread within a household. So it makes sense that we're not wearing masks. We're very close with our household members. And so when one person gets sick, a lot of other people in the household get sick. Now that's not inevitable. And we wanted to give people some prevention tips. And so we put together a video that you can find on our webpage in English and in Spanish that covers the highlights of what you can do to keep other people in your house getting sick if you do.
What are some of the biggest ways to do that? Because I think that a lot of people are assuming that if someone in their family gets it, it's inevitable the household will get it.
Right. So one of the key things is at the first moment that you think you're starting to get sick, or if you've gone and gotten a test because you've had an exposure, start separating yourself from other people in the household. If you have your own bedroom and bathroom, stay in those rooms and away from other people. Now, some people don't have a separate room to be in, but there's still things that they can do. So if the sick person can identify a corner of a room and set up other types of barriers, whether that's a blanket, a sheet, anything that could help block droplets with virus in it from spreading to other people, that can help. So that is the first thing to do, is really separate out.
Okay.
We've talked a lot about masks. Masks absolutely do help in the household setting. And so the sick person wearing a mask, if they can really help. And if they have a caregiver, whenever that caregiver is around the sick person, that can help as well.
Yeah, I think
And
the mask wearing inside, that's one that I think people are going to have to keep in mind and adjust to. Doctor, I apologize, we're out of time, but I know you mentioned you have that video on your website. We will link to that at coin.com. Washington County Health Officer Dr. Christina Baumann, thank you so much for your time this morning.
Thank you.